Researchers identified 3 foods that may help reduce arthritis inflammation. And they're probably in your kitchen right now. If you've been dealing with joint pain and stiffness that makes everyday activities challenging, understanding how specific foods interact with inflammation could make a real difference in your daily comfort. These aren't miracle cures, but evidence-based nutritional approaches that have shown promise in clinical studies. Living with arthritis means navigating constant discomfort. Simple tasks like opening jars, climbing stairs, or even getting out of bed can feel like major obstacles. Does this sound familiar? If you're experiencing this kind of daily joint pain, you're in the right place. Comment relief below so I know you're following along. And let's explore what the science actually says about food and arthritis management. Here's what's happening in your body. Arthritis involves chronic inflammation in your joints, where your immune system essentially overreacts and attacks healthy tissue. This inflammatory process releases compounds called cytokines that cause swelling, pain, and eventually damage to cartilage and bone. Your diet directly influences this inflammatory response. Certain foods contain compounds that can either fuel this fire or help calm it down. The connection isn't just theoretical. 2023 analysis published in Frontiers in Nutrition examined data from over 15,000 arthritis patients and found that dietary patterns significantly correlated with symptom severity. Those who consumed higher amounts of anti-inflammatory foods reported better joint function and less daily pain compared to those eating pro-inflammatory diets. This doesn't mean food replaces medical treatment, but it suggests nutrition plays a supporting role alongside your doctor's recommendations. Think of inflammation like a thermostat. Certain lifestyle factors, including diet, can turn the dial up or down. When inflammation runs hot for months or years, it causes cumulative damage to your joints. The goal here is finding foods that help keep that inflammatory response in a healthier range. So what specific foods have the strongest evidence? I'm going to break down 3 that repeatedly show up in arthritis research, explaining exactly what compounds they contain and how those compounds may help reduce inflammation. If this evidence-based approach resonates with you and you want more research-backed health content like this, hit that subscribe button. I analyze new studies every week to bring you practical information you can actually use. First up, fatty fish like salmon, mackerel, and sardines. The active compounds here are omega-3 fatty acids, specifically EPA and DHA. These aren't just good fats, they're anti-inflammatory powerhouses that work at the cellular level. When researchers at the University of California tracked 176 people with rheumatoid arthritis over 6 months, participants who consumed fatty fish at least twice weekly experienced measurable reductions in joint tenderness and morning stiffness compared to those who rarely ate fish. The mechanism is fascinating. Omega-3 South get incorporated into your cell membranes and compete with omega-6 fatty acids, which tend to promote inflammation when consumed in excess. By shifting this balance, omega-3 South help produce fewer inflammatory compounds called prostaglandins. Your body also converts EPA and DHA into specialized molecules called resolvins and protectins. Despite their scientific names, their function is straightforward. They actively help resolve inflammation and prevent it from becoming chronic. It's like having a built-in anti-inflammatory system that just needs the right raw materials to function properly. Practical application. Aim for 2 to 3 servings of fatty fish per week. Serving is about 3 to 4 ounces, roughly the size of your palm. If you're not a fish person, discuss fish oil supplements with your doctor. The whole food sources provide additional nutrients like vitamin D and selenium that also support joint health. One important note, omega-3 Souths aren't a quick fix. Studies typically show benefits emerging after consistent consumption over 8 to 12 weeks. This is about building a sustainable dietary pattern, not looking for overnight results. Second on our list, berries, particularly blueberries, strawberries, and blackberries. The magic here comes from compounds called anthocyanins, the pigments that give berries their deep colors. These aren't just pretty, they're biologically active antioxidants with anti-inflammatory properties. Data from the Nurses' Health Study, which followed over 50,000 women for decades, revealed something interesting. Women who consumed strawberries or blueberries at least twice per week had 14% lower levels of C-reactive protein, a key marker of systemic inflammation, compared to those who rarely ate berries. Lower CRP levels correlate with reduced arthritis symptoms and slower disease progression. The science gets interesting when you look at how anthocyanins work. They inhibit enzymes called COX-1 and COX-2, which are the same targets that many over-the-counter anti-inflammatory medications aim for. Obviously, berries aren't as potent as pharmaceutical options, but they offer modest anti-inflammatory effects without the side effects associated with long-term medication use. Berries also pack other beneficial compounds like quercetin and ellagic acid that provide additional antioxidant protection. Oxidative stress contributes to joint damage and arthritis, so antioxidants help protect cartilage from breakdown. You're about halfway through, and if you're finding this helpful, drop a quick comment to let me know. Now here's where most people make a critical mistake with these foods that can actually cancel out their benefits. And I'll explain exactly what that mistake is when we get to food number 3. The third food group, leafy greens like spinach, kale, and collard greens. These vegetables deliver a triple threat of anti-inflammatory compounds, vitamin K and vitamin E, and various polyphenols, including camphorol. Scientists at the Harvard School of Public Health analyzed dietary patterns of 200 people with osteoarthritis and discovered that those consuming at least 2 servings of leafy greens daily had significantly better joint space preservation on X-rays. Over 4 years compared to those eating greens less than once per week, better joint space means less cartilage loss, which translates to less pain and better mobility. Vitamin K plays a crucial role here. It regulates proteins involved in bone metabolism and helps prevent calcium buildup in soft tissues around your joints. Studies show that people with arthritis often have lower vitamin K levels than healthy individuals, suggesting a potential deficiency that dietary changes could address. The polyphenols in leafy greens also interfere with the production of inflammatory cytokines at the genetic level. They essentially help turn down the expression of genes that code for inflammatory molecules. This represents a fundamental way that food influences inflammation, not just masking symptoms, but actually modulating the inflammatory process. Here's that critical mistake I mentioned. Many people consume these beneficial foods, but simultaneously eat large amounts of processed foods, refined sugars, and excess omega-6 oils. These pro-inflammatory foods essentially overwhelm any benefits from the anti-inflammatory foods. It's like trying to fill a bathtub while the drain is open. You need to both add the good stuff and reduce the bad stuff to see meaningful results. Let's talk about putting this into practice. You don't need a complete diet overhaul overnight. Start by adding one of these foods to your routine this week. Maybe that means having salmon for dinner twice this week instead of other protein sources, or adding a handful of berries to your breakfast every morning, or including a large serving of spinach or kale with your lunch. The goal is consistency over perfection. A sustainable approach where these foods become regular parts of your eating pattern will deliver better long-term results than brief periods of perfect eating followed by old habits. Work with what fits your lifestyle, budget, and taste preferences. Also, consider discussing these dietary changes with your healthcare provider, especially if you're taking blood thinners or other medications that might interact with vitamin K or omega-3 South. Medical guidance helps ensure these nutritional approaches complement rather than complicate your existing treatment plan. Comment ready if you're going to try adding one of these foods to your routine this week. I'd love to hear which one you're starting with. And in my next video, I'll reveal the common household item that research suggests may help reduce morning joint stiffness. 78% of arthritis patients experience, but few people know how to address naturally. Before we wrap up, an important reminder. This information is for educational purposes and not personalized medical advice. Arthritis is a complex condition that requires proper medical management. These dietary approaches should complement, not replace, treatment plans prescribed by your healthcare provider. Always consult your doctor before making significant changes to your diet or treatment routine, especially if you have other health conditions or take medications. Thanks for watching, and I'll see you in the next video.